I hear you. Yeah, no problem.
I can, let me make sure I'm on mute. Hi, everybody. Can you all hear me? Sorry, my voice is really wonky, getting over bronchitis. So just a couple housekeeping things. If you guys could mute your cell phones so that we don't have that. And then also, if you have questions, you'll need to wait for a microphone so that the people online can hear as well, because that's the only way they can hear us. Can everybody online hear us?
Yes.
Yeah, we can hear you.
Yay.
We can't see though. Is there video?
We will get that turned on, I think.
Okay.
Jenna, can you see us now?
Sure can. Thank you.
Thank you. Can you see? Okay, so I'll go ahead and get started. I'm Amy McKeever. I'm the case management director here at Colorado Blue Sky.
I'm Julie White, Marketing and Communications Manager for the Resource Exchange.
I am Heather Mazes. I am a manager at the Resource Exchange.
Colleen Hessman, also a manager.
Nancy V. Hill, Director of Navigation and Quality at the Resource Exchange.
And Anthony Shibata with Whipley doing the strategic projects, and we'll be taking a look at a little bit today with Rachel from our team, and then joined from another with Brett Polglaze, also from our team, the strategy and change component of that.
And for those of you who don't know Megan Giratano, she's sitting here in the front. She's a service coordinator at the Resource Exchange. Rachel, are you online?
Yes, I'm online. Hi, everyone. Rachel Spindler from Whipley. It's great to meet you all.
Today, we're going to start off with a quick demonstration from Rachel and an update. If you recall, at the last provider town hall, we spoke about the database project that we are creating in conjunction with Whipley. But Rachel is going to give you a preview of that database and some of the things it can do right now. And she'll talk about the different phases as well. Rachel, it's all yours.
Awesome. Thanks, Nancy. Well, hi, everyone. Like Nancy had mentioned, I'm just going to be giving a quick demonstration on some of the features that TRE is going to be rolling out as part of our database project. So I've been working with TRE for the past couple of months now to really just identify some major pain points from TRE at the organizational level, the members' pain points, as well as some providers. And so through our discovery sessions and the time that we've had with TRE, we've really carved out a roadmap in which we hope that through the features that we're releasing are going to improve the interactions that we get from providers, members, and our TRE staff members when they interact with our IT systems. So I'll go ahead and share. I just have a very brief presentation. Won't take longer than 10 minutes, but what I really want everyone to think about as we go through this presentation is I'm really going to be talking a lot about the features that we're going to be expecting in phase 1, which we hope to roll out fairly soon here. But what we've identified for phase 2 and phase 3 are ever changing. So as we go through this presentation and I highlight some of these features, we would love to get your feedback on what you think would be beneficial to you as users as you engage with the Resource Exchange, and what features could be valuable to your organization and improve your overall just work and tasks that you complete with TRE. So I'll go ahead and get started with the presentation here. All right, can I just get a confirmation that everybody can see my screen?
Yep, we can see the screen.
Okay, thank you. All right, so like I had mentioned at the beginning here, we have a feature roadmap that we've broken out into 3 separate phases. We're hoping to go live with the first phase in May of 2024. And there's a couple major things I'd like to highlight that you'll expect from that first phase. With TRE, we've really been working to structure their data into one centralized database. And as part of that, we're going to be having one established provider database. So all the information that we're currently hosting on our providers will be available to us in one singular system. We've also been working to develop a universal intake form so that users have another alternative route to submitting an intake and referral form to TRE through an online portal that we've developed. We're enhancing our existing service request form for us to get our members into services, to hopefully streamline that process and get members into services quicker by sending out requests to our providers and allowing us to track our provider responses and get that information back into the system. After I go over phase 2 and phase 3, I'm going to be providing a quick demonstration on what that new process is going to look like for our providers and how you're going to see some of those changes as we go with our phase 1 release. In phase 2, which we hope to release in July of 2024, we're going to allow our members to have access to a portal and have the ability for them to choose those selected providers. In addition to that, we will be notifying our providers when they've been selected to provide a service, as well as notify providers if they're not selected for a service as well. Lastly, in phase 2, we understand the importance of providers being notified when there's a change to a member's care team. So we'll be automating those notifications to ensure that providers are notified in a timely manner as soon as that change occurs. Lastly, in phase 3, we hope to roll out a provider portal to allow you visibility into the multiple service requests that you may be receiving for multiple members at a time. Also into getting visibility into the members and the members that you are providing one or more services for. And then lastly, we hope to implement automations to enhance those processes, as well as a chatbot for you to get quick answers that you might currently have to be reaching out over email or through phone call with members with staff at TRE to get answers for. So that's what you can expect in the 3 phases that we've identified at TRE. Like I had mentioned before, phase 1 is those established. These are the items we know that we're going to be releasing in our first release. But phase 2 and phase 3, we really want to receive feedback on from you as providers to understand what features you think may be valuable as we continue down this roadmap with TRE. All right, so now I'm going to move into just a quick demonstration. So I wanted to highlight what you'll expect to see as a change for phase 1 as we change our process for service requests. So I understand that currently all service requests, you're receiving an email from TRE, which directs you to a Microsoft form. Through that Microsoft form, you're required to enter in some additional information on what was received in the email to go ahead and approve that service. Through this phase 1 approach, we hope to simplify that request here. So you'll still be getting an email for those service requests. This is sample data, so not data on an existing member in the system. But what you're going to see here is that member, the services that they're interested in and getting you to provide that service, and then some key information about that service. So the start and end date, the number of hours, and then any coordinator notes that the coordinator has included as part of that request. What you'll notice on this email is that I have a link here, and once you click on that link, it's going to direct you to our portal. Here is a sample here of what the portal provider response form is going to look like. So instead of filling out that data, referencing the email and entering data back into that form, you'll be able to just directly approve or deny that request. You're still going to get that information here on that member and that service, but through one singular field here, you're going to be able to accept or deny that response, and then that response is going to be directly sent back to TRE for the member to move forward and then do the provider selection. So that was just a very brief demonstration on what that new service request process is going to look like. Also, those features that you're going to be expecting from our first phase and then continued phases. I know that demonstration was brief, but I would like to open it up for if anybody has any questions on what to expect as part of this first phase, and also any ideas or areas or feedback as we move into phase 2 or phase 3. So does anybody have any questions?
Hi, this is Jennifer Risdall. I'm the director with Stellar Care and Services. Can you all hear me?
Yep.
Okay. So one of the concerns that I have, and I don't know whether there's more information provided once you click that link and you indicate accept or deny. But part of the problem is that the content and the information that we're receiving to assess whether or not we can meet the needs of those individuals is often very vague. And so when we're responding to a referral, we're responding to it in most cases to get more information. So is that still going to result in the 100.2 being sent to us so that we can further assess? My concern is that if we just go in and hit accept, and then all of a sudden the client reaches out to us and says, we chose Stellar Care, if we at that point haven't been given the information to fully assess whether we can support them, that's a setup for everybody involved.
Yeah, I apologize for leaving that out of my demonstration. So after you hit accept, that will indicate to TRE that they have the go ahead to send those documents. So you should receive a follow-up email shortly after that with the documents that TRE provides. So thank you for pointing that out.
Okay, and that is what is happening now. I just wanted to make sure that that was going to continue and we weren't just going to be contacted by an individual or their guardian indicating that they want to use us. And obviously every program approved service agency out there wants to support as many people as possible, but we also want to know our limits and making sure that, you know, we have appropriate staff to support them and appropriate providers to enroll them with. So.
Yeah, absolutely. Thank you.
Sure.
Rachel, I was just going to clarify for the room too, for all of you who know this as a referral process. When she says service request, that's what she means, that it's actually the referral we're going to send to the providers.
Awesome. Any other questions out there?
Rachel, were you going to talk about the end too? Right now, I know you have questions, but what we wanted to do in this database also, we heard loud and clear from a lot of our providers that once you hit accept, that nobody knows who was picked as the provider, because the person in services, what we're intending to do is either for them to go into the portal and to be able to see, you know, for residential services, these 5 agencies said that they could serve you. The person, the member or their family can then go in the portal and see that. They get to interview or question whoever they want to provide that service. Once they pick the provider, an email will automatically be sent to those other providers who were not picked, but also the agency that was picked will also get an email that says, this member has selected you as their provider of record, so that it closes the loophole for everyone. We heard specifically in El Paso County that there was nobody knew who which provider was picked. So we wanted to be sure that we close that loophole as well.
Any additional, so I know I asked for questions, but is there any additional features or ideas you think could be helpful as we move into phase 2 or phase 3 outside of what Nancy had just mentioned about, you know, being notified if you were not selected for a service? All right, well, if there is anything that comes up, feel free to communicate that with us. We definitely want to hear your feedback if there's anything that you saw from today's demonstration, or as we look, as I talked about the features of the roadmap, if anything comes up down the line, feel free to let us know. Nancy, is there anything else that I might have missed in my just brief demonstration that you would like me to cover while I'm still on the call?
A couple things from the last town hall meeting. We also heard that loud and clear from everyone that when she said you'll be notified when there's a care team change, she means that means when the case manager changes. So you will be notified anytime a service coordinator or case management changes for that member. So that will be in phase 2, correct, Rachel, or phase 3?
That's a phase 2 item.
Okay. The other thing we also wanted that we heard loud and clear from you all, the last provider town hall, was the PARs. And that everyone says, where's our PAR? Where's our PAR? Where's our PAR? We're like, okay, we sent it 10 times. You all were like, we didn't receive it 10 times. So the provider portal is going to be a place where the providers can go in. We're going to drop all that information in that portal. You go up, you go in there, you pick that PAR up whenever you need to. It's going to be there. So we're trying to eliminate all the back and forth. I think all of us can really live and understand that we communicate back and forth at least 50 times on one thing. We're trying to eliminate that so we can just do our job and move on. Another thing we wanted to remind you all about was the tracker. The tracker is going to be in phase 3. So you all and the member can see from intake all the way through ongoing case management. You can see where a person's at in a process. We know for intake, for example, that there are some bottlenecks in the system that members get really anxious, as do providers. Number one is financial eligibility. We know that takes a while to go through, but I can tell you on a daily basis, we probably get 400 plus emails. Where are we at? Where are we at? Where are we at in the process? You can go into the portal and check. We wanted to eliminate all that communication so you all know where someone's at. Same with the revision. If you're waiting for a revision, what we hear is we need the PAR for this or that or this or that. That way you can see too, okay, this was the date the service coordinator talked to the family. They're in process. The service plan is being developed for that revision. And then the PAR will be created so you can all go in there and see that too, as well as a member.
Is there a process that errors will be addressed on PARs? Will that kind of still be the same as it is right now? If units are missing or?
Yeah, that will be the same, Jennifer, not unless you have any great ideas of how this portal can help us fix that.
Okay.
We did throw out the idea, Jennifer, of creating maybe a form or something. I'm not quite sure. We didn't get that far yet. But it just came up recently about trying to create something where you guys can tell us, because sometimes what we get is, hey, we have this billing error, and you show the coordinator this billing code. Well, they don't have access to that. They don't know what you're talking about. Or we might not have the dates or what service or what, or so we'll email back and they'll be like, oh no, we wanted the other plan here. And then it's like a lot of back and forth. So we are throwing around the idea of trying to put something together where you can say what cert span and what services and what you're looking for. That way we can make sure we're all talking the same language and hopefully can get those without a lot of back and forth.
I have a question real quick, Nancy. This is Jenna from CARE. And going backwards just a little bit to the portal that you all were just talking about, when a provider clicks the accept button, I understand that that will trigger TRE to say, to send more information such as the 100.2, but how will TRE differentiate whether we're clicking the button because we want more information or because we're truly accepting that referral? I wonder if you guys have considered having, you know, maybe an interested option that would signify to TRE, okay, they're interested in more information, and then an accept option where where providers can truly formally accept that referral.
I actually think that is built in there. Rachel, can you speak to that?
Yeah, so at this time, we do only have those two options for the accept and the deny. And the accept would be indicating that the documentation would be sent. And so I think maybe Whitley and TRE might just want to connect again to make sure that we are giving providers the correct options on whether they are truly accepting or whether they are just interested, because I think that may require another option that we want to talk through. So Nancy, is that something I could connect with you on maybe later this week?
Rachel, you'll probably have to talk to us about that in our next meeting because I am booked solid.
Okay, that sounds good. I'll reach out to you over email. Thank you.
But Jenna,
So-
that's a great suggestion.
Yeah, I would agree as well. And I think right now, we do fill out that web form, so to speak. But there's a comment section where we can indicate that, based off of what was in the original referral, we may have some good providers, would love to get more information so that we can further assess whether we have a good fit. So we have that opportunity to communicate that up front, but if it's just a simple like accept or deny, that might just get a little bit sticky.
Sure. So I don't want to take too much more time because I could go on for a while, but today, after you guys just get that information, then and you say you're interested, you get the 100.2 assessment. Then is the follow-up just include like email back and forth to say that you're truly interested in accepting the referral?
So the problem here kind of goes back to what Nancy was talking about with closing the loop, is that I would say probably 80 to 90% of the time we don't hear anything other than getting the 100.2. So we don't know if someone chose another agency, if they there's just no follow-up to us at all unless someone reaches out saying, TRE gave me your name and number and it looks like you might have a host home, or we're interested in talking with you about family caregiver. But it usually is either we don't get a response at all, or it's kind of a delayed thank you for your interest and someone chose another agency. So
I see.
we wouldn't really, the only time I would reach out to the service coordinator directly is if the referral is extremely vague, or if there's information in the referral that makes me have like a very specific question. So for instance, if someone says this person's getting discharged from rehab in 2 weeks due to a fall, I'm like, okay, do they need a home with a main level bedroom? Because if that's not on the referral and I know that that is what is needed, then that's going to very much limit the resources that we have available. So sometimes I will reach directly out to the service coordinator listed and ask that specific question. But that would generally be the follow-up that I would provide.
Okay, awesome. Well, thank you so much for providing that information. And we do have like that comments box. So that could be a place to provide some more info, but I'll also follow up with the resource exchange to see if there's another option that we can add to that drop down. So thank you for bringing that up, and I will stop there. So thank you.
What I'll add is our current process is a form that the service coordinators fill out on our SharePoint site, and that's what sends out the initial email. And then when you guys all accept, that's when it sends the additional documents. Sometimes what we run into with that process that hopefully will be eliminated with the database, knock, knock, is that sometimes we have providers who don't answer at all, and they reach out to the member. And if they haven't accepted the referral, that's sometimes where we have trouble, because we can't go in and close it if that provider hasn't said yes. And that's why sometimes you're not getting, I won't say that's all the time for those on the computer, but that is sometimes when we can't get you that response to say somebody else, the member's chosen somebody else. It's because if that initial provider kind of went around the process a little, which is fine to get business. We just then can't get those answers back out to people. So.
Does anyone else have any comments or suggestions for Rachel before she signs off?
And I do apologize. I actually do have to drop, but I appreciate your time and thank you guys so much for your feedback. I'm looking forward to hearing more and after the release of phase 1. So thank you so much, everybody.
Thank you, Rachel.
Bye.
The next thing we wanted to talk about was TRE's website and what's included in there. So for all of you members or providers, sorry, if you go to TRE's website, it's www.tre.org. You will see we have a section specific to the Pueblo transition. And on that link, you can access all the information about town halls. You can review the recordings that we did. We also have an FAQ up there that you all can access. So if you're not able to make it to a town hall or have general questions that are being asked, you can refer back to that page and you can get some of those answers. We also ask that you all help us spread the word to members. We're hearing that a lot of the members don't even know the transitions going on. And so if that's the case, I know PDI has been extremely helpful and they actually put our information on their newsletter so that all their members can see that information in their newsletter too. You are all welcome to put that in your newsletter if you'd like as well. That we just want to be sure that everyone's aware. And so I worry a little bit about who was invited and who wasn't. Maybe providers are like, we know enough already because our group here is really small today. And I'm a little worried about that, but maybe I don't need to be worried. We also wanted to talk about our location. We have secured the Wells Fargo building, and it will be somewhat ready on March 1st. We will have our front desk reception area and some working space. And that address is 201 West 8th Street, Suite 600. We also have this information on our website. Our telephone number to reach the Pueblo office will be 719-601-9991. We also have a 1-800 number or a toll-free number, 1-877-423-0323. You do have to mind the construction though. Like I said, it will be a work in progress. So please bear with us while we get that office up and running fully. Do you all have any questions about that so far? No? Okay. You guys are really quiet today.
Have you identified all of your staff yet for the Pueblo office?
Almost.
Okay. How many coordinators will you have?
Right now, I have, let's see, 14. I had that number written down and I forgot to bring it with me. About 20 coordinators
Okay.
currently.
So do you have a organizational chart as far as a hierarchy, who's going to be what, and contact people for service providers to contact for certain different aspects of case management?
We have that on our website too. We were going to bring the printed out versions, but I think we forgot them.
Okay.
So I apologize, but we do have them currently. Everything's on our website. We put it all up there.
The only thing I'm seeing on your website, and maybe I'm just not seeing the right place, is the DHS Pueblo County resource. Rajan, is that Rajan?
Yep, Rayshan.
And then Dana. Those are the only two people I see listed.
Julie, can you
going?
put the website up on?
Nancy, it's Jenna again. I have another question and I can't hear if I don't think anybody in the audience is talking, so let me know if I'm okay to go ahead.
Oh, hold on 1 second, Jenna.
Okay.
We're trying to pull up the
I found
website.
it.
Okay, you found it?
found it,
Okay,
yes.
thanks. Did you have another question?
No, that was it.
Okay. Go ahead, Jenna.
Nancy, I heard you mention that you've heard of lots of members, maybe not knowing that the transition is happening and also, concerned about providers. Does TRE have a toolkit of sorts, maybe like a flyer that's ready-made that can be dispersed to members or provider organizations? I wonder if that might help kind of spread the word. I know everybody's bandwidth is really strained, so for provider agencies to come up with these flyers, that's probably not going to happen. But if you have something ready-made that can be dispersed, that might be helpful.
Jen, we did. We created flyers both in conjunction with CBE and Pueblo County. Julie, did you put those on the website?
We sure did. We did just what Nancy said. They were first distributed through HICPUF. And then they were distributed through DHS as well as Colorado Blue Sky. And that was a process that started back in October.
Okay, and those flyers are available on the TRE website?
I believe so. If they are not on that page, I can check and see where they have been posted.
Okay,
But
thank you.
To your point, it is a continuous communication process that it's an endeavor that we are going to continue throughout this process, even post-March. So it's not just from TRE, it's in conjunction with our partners. So we are asking for everyone's help in collaboration with this because it's a collaborative process that we are asking everyone to be able to communicate that to members here in Pueblo as well.
What if you put a banner at the top of the page that this is for Pueblo transition? So it could be a temporary banner, right? That just would be at the very top of the page. They could click on it. It would take them to this. That might be easier, especially for our families, right? To find that information. So just a quick little red banner that says that. So would that be an option on your guys' website? Yeah, because maybe that would help. And even if you put it across every page for a while, so that no matter what you click, for instance, like a lot of us, when we do an event, we put that banner up there. So that's the first thing they see, no matter what page they go to.
I believe we can. We can look into that and see what our capability is. Thank you.
Any other questions about our website? Okay. I wanted to talk about the state of Colorado and all the changes that we're going through as well. You all know that we're going through the case management redesign right now, conflict free. We had the PHE unwind, and there are many, many, many breaks in eligibility. I think right now we're aware of, just in El Paso County, we have close to 600 that changes daily. I'm sure the numbers are somewhat staggering here in Pueblo too. The Resource Exchange, Colleen Head Bachelor, our CEO, along with a lot of the bigger Denver metro area case management agencies, have met with the JBC, and they've met with healthcare policy and financing. Because it's caused the long-term care system to somewhat be unstable right now. We understand that you all have, as providers, are not getting paid. For smaller mom and pop organizations, it's really hard for you all to sustain. For the members, they're without services. The resource exchange, same thing. If you all don't get paid, we don't get paid either. We have to have a billing code in there too. And so that means it is trying times for everyone, specifically our members. And we do not want them to go without services. They're in services for a reason. It's needed and it's required. So we have spoken to the JBC and Healthcare Policy and Financing. Oh yeah, sorry, Joint Budget Committee. Our politicians in Denver. And they are listening. We don't have any resolution right now, but they're in talks with all the CMAs. And there is also a group of providers that have spoken up as well. And if you're aware of Alliance, they are also speaking up. We just wanted you all to be aware that we are hopeful that Healthcare Policy and Financing and the Joint Budget Committee will come with a resolution soon, because our world is really, really turned upside down right now. The new care and case management system has not helped in this transition either. So we're working through all of that. Does anyone have questions about that? We don't know what their options are right now. That's why we're like, listen, providers aren't getting paid. We're not getting paid. That means the members are going without services. We receive on average, the resource exchange alone, just with El Paso Park and Teller, I can guesstimate that we receive over 2,000 emails a day requesting help from members, providers, like, we need help. We're not getting paid. I'm not getting paid. I'm losing my care. And so we are like, we need help.
And then again.
Yeah, can you
received
re-ask the question?
success. What kind of pressure is being put on local DHSs to actually do their job? Because we send in the information, we get the little success banner, and then a month goes by, we still haven't heard, we call back, send your information again, we get another success. Meanwhile, people are going without services, or agencies are having to put the bill for services that they're not being paid for. So are they going to sever that tie that they created 5 or 6 years ago, where the two had to go hand in hand for a person to be eligible for services?
So it's a great question. And yes, it is a big question. From what I know and understand, the counties they're receiving help from outside MA sites or medical assistant sites, but that's for very limited cases. And we know, like with El Paso County specifically, El Paso County techs have been working overtime for the last 8 months. And they're hoping that once the PHE, when did it start? About 8 months ago? Yep. Yeah, May, they're hoping that in June it'll stabilize because everyone's been through the process at least once this year. That's not a guarantee. I know healthcare policy and financing has created an escalation process for those for DHS to help with that. What that entails, I'm not 100% sure. I don't know. I don't know if it's working. You all will have to tell me. Have you used the escalation process yet?
Yeah, but I think that the issue that we're having on an individual basis for our customers, for our consumers, is that if somebody has a job and it doesn't matter how many times we send in, this is what they're making, their benefits just keep going down and down because no one's really entering that data to give an accurate accounting of what this person should be receiving. I'm not convinced that this will be fixed by June. I mean, our Denver office, we're $500,000 unfunded right now. And so I just don't know how they take all of these people who are backed up and fix it by June. And then once they've been to the system one time, it doesn't happen again. It's a manpower thing. And if the manpower doesn't get fixed, the problem's not going to get fixed. So.
Well, yeah. So starting this last Monday, healthcare policy and finance. Yeah, today's Tuesday. Yeah, we're going through what's called streamlined eligibility now. So what that means is Pueblo are the counties, CBMS, that's their database that they enter information into, is supposed to connect directly with our system, which is the caring case management system or the bridge, so that we don't have to exchange documents anymore, specifically the level of care, cert periods. Right now we're seeing that we do have a lot of close dates for February 29th, but we've not seen the 3/1 starts. And that's what we're keeping a very close eye on that, because if those systems don't talk, all those cases that were closed 2/29 will mean there will be a break in eligibility as of 3/1. But I'm telling you, we're watching that like a hawk because we're really afraid. But if it goes through and works well, it will make our lives a lot easier. We've also heard from healthcare policy and financing that in January of 2026, they are going to implement or trying to implement presumptive eligibility, specifically for our long-term care members. So what that means is the intake process will be shortened dramatically for our individuals going through intake, because they could be presumed eligible until intake is fully completed. So that I'm looking forward to. I think I suggested that to HICPA probably 10 years ago. Oh. Yeah. I'm like, why don't we do presumptive eligibility? So I think they have to ask the feds for approval for that. But it's supposed to, I'm like, I wish it would happen this summer or sooner, but it's slated to roll out in 2026. Hello?
So with the streamlined eligibility, what's happening, hopefully as of yesterday, when the service coordinator enters the level of care, it will communicate back and forth. It should take us a few days to be able to see both our systems updated, to know that everything's gone through okay. So that's part one. Part two is we're going through training now on access to Peak Pro. So what that'll allow us to be able to see, we haven't been provisioned yet. I know I haven't gotten a login yet. And that's supposed to roll out 3/1. But I have training this Thursday, so I can't tell you much yet what we'll be able to see and not see in there. But we should be able to see what historically the notes are left by DHS. So if it says that, let's say the member submitted all their typical renewal documents, and now all of a sudden one of those magical historical documents pops up that they need extra, we should hopefully be able to see those notes and be able to communicate them. Now I don't know if it'll automatically tell us those things, or we'll just have access to be able to see those things. So it still may take that request to, hey, what else do I need? So we may be able to get those answers quicker than we ever could before, too.
Just on Peak Pro, I'm being cautiously optimistic about using Peak Pro. I think I've gone through Peak Pro training about 20 different iterations, and it should tell you something that we've still not used Peak Pro, and we're on the 20th iteration. So take that how you will, but cautiously optimistic. That's all I have to present on today. What questions do you have for us that we have not answered yet?
I'm from Pueblo District 60. So we're looking at more of the intake part from your side. So how can we partner as a district with you guys? I don't know if that's a conversation we have after this or what.
You know, I would love for us to partner together. We may have to set up scheduled quarterly meetings. I don't know if your districts are like in El Paso County, but the turnover is constant. And we don't have right now the bandwidth or the manpower to attend every school's meetings. But I think collectively we need to figure out a set schedule for at least quarterly, so that we can have the community come and ask us questions. We can answer those, so we can help educate them on the intake process and what needs to happen so that we can get people enrolled into services.
The other part of the database project that we're working on that wasn't demoed today is a more comprehensive intake process for that can all be done online. And so when that rolls out here in phase 1, that is also something that we can work with you guys on. It'll be super simple to make that referral over to us instead of having to scan and email and email and email. It'll all just be on this online form that will come to us. And so that will make that kind of communication more streamlined between us as well. And so hopefully that will help. But thank you for coming. We always appreciate having the districts in attending these things, because you guys are a huge partner for us.
Are there any other questions? Are there any questions online?
Hey, Nancy, it's Kyle. I see one.
Low area, are there any fairs or resources?
Fairs or resources? We are implementing a resource page on our website. We're actually working to gather that information to include on our website. We do have a resource page there now currently, but that's specifically for El Paso Park and Teller. We're creating one for Pueblo County specifically. Hold on, Terry.
Wait for
Yeah.
Yeah, they had asked, they're like, we can't hear the question, wait for the mic.
So I think to just PDI hosts a resource fair every quarter. or I mean, twice a year, especially without the school year, along with District 70. So I know our next one's going to be in April. So that's something that you and I need to chat about anyway, as we talked about before. But, you know, like those are out there too, where we get all agencies together. I mean, you know, each twice a year that you can learn about the resources that are out there, no bias to it or anything. We invite anybody and everybody. So like that's one thing that's happening at County High School in April.
Okay, thanks. And we, in El Paso County, we have a quarterly provider fair that we invite all our providers to join, so that they can even meet and greet with our service coordinators, so that service coordinators can help spread the word about the services you provide, any specialties that you all may hone in on, whatever the case may be. But we plan on setting those up as well here in Pueblo County, but first we have to get through the transition. Yep. Kyle, can you introduce yourself to the group too, please?
I can. Good afternoon, everybody. My name is Kyle Cox and I serve as the intake manager here at the Resource Exchange. And I've been here going on about 9 years. So looking forward to getting connected with the Pueblo community and visiting our office down there and hopefully getting to know everybody in the room in person at some point. So thanks for being here.
Anthony, anything you'd like to add? Okay. Dana?
About that intake form, is that on your website?
Yes, right now we have an intake form on our website. It's actually at the top of the page in an orange banner. And it says, fill out this intake form. But the one that Rachel was talking about, that will be incorporated into the database and on our website during phase 1, which is slated to roll out in May. So. Oh, there are. Never mind. I scratch that. That's for another meeting. I have 80 million meetings in my brain right now. So, well, looks like everyone's ready for bed. Yeah, it's hot in here, which makes it really, really tiring. Well, we appreciate you all. Oh, there is one more thing I forgot to tell you all. So this will be the last provider town hall that we have. However, we actually have what we call a provider executive meeting on a monthly basis. You all will be invited to attend those meetings. We want to hear from all of you all the time. We're always up for feedback. What can we do better? What do we need to change? Pain points you are all going through. So look for that email. It comes from Tammy Ingram. She's Colleen's administrative assistant, but she kind of herds all the cats together for us. And so if you receive an invite or don't receive an invite, let me know so I can make sure and get you added in that group, because we do want to continue having monthly meetings with everyone. So we're all on the same page. That's when we'll talk about the resolution that JBC and HICPUF came up with on our concerns. We'll talk about presumptive eligibility and how that's going on, any new hiccups in the system, whatever the case may be.
Tammy will send out before the meeting a request for agenda items. So if there's stuff you have questions around, she'll make sure she has the right people at the table.
Well, go out and get some fresh air, everyone. Thank you for joining us. We appreciate you all.